Hello friends, welcome to my new video. So as you can see in the first slide there, the topic is headache cause, types and management. So here we're going to talk about a headache today. So which is most of us have certainly encountered at some point in our life. A dull discomfort, occasionally a strong throbbing pain that seriously interferes with our day-to-day activity when it happens. However, did you know that one of the most prevalent medical complaint worldwide is headache? They have a substantial negative impact on millions of people's quality of life. So we will discuss what headache is, why it occurs so frequently, and how it is categorized in this presentation. So first, we will divide this headache into two broad categories: primary headaches, such as tension or migraine, that are not brought by any other underlying medical conditions or illness, and secondary headache that can be brought on by other medical conditions. So let me put the laser pointer here. Fine. So here, let's go to the next slide. So this is the headache classification where, as I told you earlier, headache is divided into two main types: primary headache and secondary headache. So primary headache is like tension headache, migraine, cluster headache, or exertional headache. Exertional means you did lot of exercise and lot of hard work, and because of that you got the headache. Something. So this primary headache is not as actually it is associated with any systemic condition or systemic illness, but secondary headache it is because of other body illness that we will discuss in the next slides. But today in this presentation, I will only focus on tension headache. And in the next consecutive video, I will cover all these headaches in separate presentation so that you will understand it in a better way. So today we are only focusing on this tension headache, how it happened, how to understand that it is a tension headache something. Okay. So here in this slide, you can see that this is a tension headache. So this tension headache it is the most common type of headache. I think most of us have been through this at some point. It feels like a dull, continuous pressure surrounding your head as if your temples were being squeezed or tight bent. So although it's not the worst headache you may have, the discomfort is typically mild to moderate and can last for hours. So if as I told you earlier, that in this presentation, I will only discuss about tension headache, but I have to give you a brief idea about other headache also, like migraine. So this is the migraine. So if I talk about migraine, then um, so here they can be quite harsh than tension headache. So, when experiencing a migraine, most people describe the pain as throbbing usually on one side of the head. But migraine are not just about the pain. They can also cause light and sound sensitivity, nausea, vomiting. So, you may be unable to operate normally for hours or even days due to migraine. And if I talk about this cluster headache, so cluster headaches are considerably more severe and quite different. Severe discomfort is frequently reported, typically affecting one eye or one side of the head. So these headaches typically occur in clusters, which are periods of time when they occur every day for a few weeks or even months. So they also affect more frequently. Although it is extremely painful, cluster headaches are fortunately it's not very that much common type. And I told you another type of headache here, that is the exertional headache, right? So exertional headache. So the strange thing about this exertional headache is that they can be brought on by physical exertion, such as coughing, exercising, or even merely climbing upstairs. So they typically don't last long, but they can be abrupt and rather intense. Thus, if you ever experience a headache following a physical activity, it's probably an exertional headache. So if I go to the secondary headache, these are secondary headache like post-traumatic headache. So here is the post-traumatic kind of headache that arises after a head trauma or injury is known as post-traumatic headache. From the name you can understand. So it might last for weeks, months, or even years after the injury and usually appears 7 days after the damage. So this post-traumatic headache is similar to tension type headache, migraine, or other type of headache, and its intensity is generally related to the type of trauma that occurred. Okay. And another is like medication overdose headache. So another type of secondary headache is this medication overdose. So it's known as rebound headache, ironically. So these headaches occur when we take too many painkillers to deal with headache. So it's a vicious cycle. To more medicine you take, the more frequent and intense the headache can become. So this is why it is important to use medication wisely according to the advice that your practitioner given you. Now another is sinus headache. So if I talk about the sinus headache, then if you ever had a bad cold or sinus infection, you probably know what this feels like. The pain is often accompanied by facial pressure, a stiffy nose, and something a runny nose. Sinus headache can be quite uncomfortable, especially when you are already dealing with other symptoms of congestion. So these are the types of headache that I given you the brief knowledge. Now, as I told you earlier, today I'm only focusing on this tension type headache. So tension type headache are probably the most common type of headache people experience. You know, the dull, aching pain and tightness that feels like bands squeezing your forehead and wrapping around your head. So that's a tension type headache. Unlike migraine, it does not usually make you feel sick or overly sensitive to light or sound. So a Danish epidemiologic study revealed that about 78% of the adult population has at least one episode of tension headache in their life. So it means that everyone had this type of headache once in their life. So why it happened? What is the cause? As I here written already, stress. We have all been there. When life gets stressful, tension headache often follow that. Muscle tension, tightness in your neck and shoulders can cause this type of headache, especially after sitting for a long period in a specific position. That can also lead to tension headache. Posture, it's very important. Sitting hunched over a computer or bend manner in your desk can also lead to headache. Fatigue, if you are overtired, a tension headache can creep into you because of this fatigue. Eye strain. Eye strain here, staring at screen for too long without a break can cause this kind of headache also. So it is also found that in many studies that because of the lack of vitamin B12, it can lead to tension type of headache. And if I tell about the signs and symptoms here, first, dull ache pain. It's not the sharp, intense pain of a migraine, but more like a steady ache that's hard to ignore. Mild to moderate in intensity, like it's not usually severe, but enough to be bothersome. Here, bilateral pain. Here, it means that both sides of the head. Unlike some headaches, this one typically affects both sides of the head. And here you will have vomiting tendency also, and tenderness. You might feel some tenderness in your neck and shoulders or head. So here in this picture, you can see the band-like thing, neck pain with this bilateral both sides pain in the forehead. That is tension type headache. Now you will ask me one question. As an optometrist, people say that we had an episode of headache. We went to the physician and he sent us for eye examination. So the headache, that is because of the refractive error, what is called. So here I have refractive error, it is myopia. Now because of that, the person have headache. And after getting corrected, the headache goes on. Okay. So if you are experiencing headache due to a refractive error like being myopia, hypermetropia, and astigmatism, it's usually a type of tension headache or something. Sometimes you can call it as ocular headache. So this headache happens because your eyes are working too hard to focus, especially when you are reading or using computer or trying to see things clearly without using glasses or contact lenses. So this extra strain can cause pain around your eye, forehead, and temple, leading to the dull aching feeling. So luckily, once you correct your vision with your glasses or contact lenses or surgery, this headache usually go away. So it is a kind of tension type headache. Okay. So in history, how you will take the history? First, the most important question in the evaluation of headache history is ascertain whether the history headache, whether the headache of the is of primary or secondary. Primary headache are recurrent headache, and the new onset headache should undergo assessment for the secondary causes also. In case of recurrent headache, the next important question is the current episode is similar to the previous headache or not? If this headache is similar to the previous episode of headache, like that is definitely it can be a primary headache. If the current headache is different from the previous headache episode, an evaluation for the secondary causes is also very much important. Why should you take risk? Recurrent headaches are called tension type headache, and the patient must keep a headache notebook in which they record the onset, length, and intensity of the headache as well as things that make them worse or better. For a tension type headache diagnosis, here there is a society called International Headache Society require at least 10 headache episodes, and the length of this headache varies from 30 minutes to 7 days. I'm telling about tension type headache. It lasts for roughly 4 to 6 hours over an average. The headache are generally bilateral in nature and are categorized as non-pulsating, dull, pressing, or band-like tightening sensation. Additionally, they are mild to moderate in severity and do not worsen with ordinary physical activity like walking or climbing. So you can do the ordinary physical activity also. But this patient carry their daily activities. Okay. Now, some individuals may also report sleep difficulties and tension in the muscle of their neck or shoulders, something. Such kind of things can also be there. So all these things you need to note it in your history. So as I told you, detection of the headache, whether it is primary or secondary, is very important. So red flag for the secondary disease. When you take the history, sudden onset of headache is very much unusual. Age of onset of headache after 50 years of age, very severe headache, new onset of headache with an underlying medical condition, headache with concomitant systemic illness, focal neurologic sign or symptoms, and papilloedema, history of head trauma. All such things indicate it can be something else, like intraocular tumor, meningitis, such kind of conditions. These are secondary type of headache. So it seemed to the patient or the initial examiner that it can be primary headache, but after taking the history properly, the practitioner should send the patient for secondary evaluation also, not to take the risk. Now, International Headache Society diagnostic criteria. As I told you earlier, at least 10 episodes of headache should be there, lasting for 30 minutes to as long as 7 days. Bilateral located, pressing or tightening quality, mild to moderate intensity, not exacerbated by routine physical activity. That means they can do the routine activity as well. No nausea, vomiting, no more than one of photophobia. That means they are not having any photophobia symptoms. So these are the criteria to diagnose the tension type headache. Now let's go to the management. First of all, if I tell about the management, lifestyle modification plays a very much vital role, like stress management, posture management properly, sit properly, something, take break. Stepping away from your computer or phone for a regular break helps prevent eye strain and muscle tension. So you have to follow the 20-20-20 rule. In every 20 minutes, you should take a break of 20 seconds and see a distant object, blink several times. Such kind of things. Now, another is like medication. Consult with the practitioner, medical practitioner, and you can take the medication. Like they can give you the painkiller, over-the-counter medication like ibuprofen, acetaminophen, or aspirin can all be helpful there. Or prescription medication if the headache are frequent. Doctor might prescribe some stronger preventive medications also. Another is like physical therapy. Exercise that strengthen your neck and shoulder along with gentle stretches can really help release the tension that lead to this headache. And proper sleep. Make you are getting enough rest, as being overtired can easily lead to headache. And exercise, regular physical activity like walking or swimming can actually help prevent tension headache properly. So that's all, friends. Thanks for watching, and please don't forget to like my video, subscribe to my channel. And this is the end of this tension type headache. In the next video, I will focus on migraine type of headache. Thank you so much.